I'm David Lee. I am the Executive Director of the National Bone Health Alliance.
Thank you, David. Can you tell us a bit about the National Bone Health Alliance and your role with the organization?
Sure. So the National Bone Health Alliance was established in late 2010 as a public-private partnership on bone health. We have 56 organizations currently around the table that represent the private sector, nonprofit and specialty societies, as well as 5 government liaisons from 5 HHS agencies. My role as executive director is to help lead with my leadership the major projects of the Alliance, really figuring out what things we need to do collectively as opposed to individually to drive bone health awareness, including osteoporosis and other bone rare diseases.
I understand that the Alliance has developed a tool called the Fracture Liaison Service Return on Investment Calculator. Can you tell us a little bit about this tool and what it's used for?
Sure. So one of the biggest initiatives we have is driving a care coordination model called a Fracture Liaison Service, which ensures that after someone suffers from a fracture, they get appropriate screening, diagnosis, and treatment if they need it. So this return on investment calculator is enabling individual sites, physicians, other healthcare professionals to make the business case within their institution to set up these types of programs, to really look at the revenue they're going to be able to capture by capturing these patients. Offset by the salaries of the coordinator that serves in the role and other things to make the clear business case to their institution that it is a financially viable program and will not only help increase patient outcomes, but also save healthcare dollars.
So it's a tool for healthcare professionals and post-fracture patients, they serve.
That's right. Actually, the healthcare professionals themselves will use this and actually plug in their own historical fracture volume, number of patients they think that they will capture, and then it actually will spit out a 2, 3, and 4-year estimate of what the bottom line of that program would be. And this is something that we worked with the Research Triangle Institute as well as the University of Alabama, Birmingham on, and really pleased to have it out within our membership as of last July. And I know lots of folks are really appreciating using it to start to have these more granular business conversations.
That's great. We have one final question. What was your biggest takeaway from this year's BioPatient and Health Advocacy?
Sure. So I think it really is, and I see it in the MBHA as well, the power of bringing together the sectors. Lots of folks from the private sector, lots of different flavors of pharmaceutical, biotech, imaging, et cetera, many patient and advocacy groups as well, especially societies, as well as government folks here, all really learning from each other, learning how they can work together more closely to really drive at the end of the day that patient conversation to get therapies needed for patients and to have those used in a way that really helps improve patient outcomes.